wheezing difficulties. But in anaphylactic shock, what will happen? Few seconds of apnea will be observed in certain cases. Slow breath rate will be there. Pulse rate in an anaphylactic shock is going to be slow, weak, but a regular one. However, if we are going to talk about the pulse rate in the vagal shock, then it is an irregular pulse rate. Now the skin, how the skin of the patient will be observed in the anaphylactic shock. It will be the clammy skin, pallor one. Diaphoresis will be observed. In the vasovagal shock, patient will show pruritus or urticaria, where swelling of the face and tongue will be there. That's why the airway patency is very important. And now blood pressure will be low in both the shocks. Hypotension will be there. In vagal shocks, systolic pressure will drop down below the 90 mm Hg, which may also, if not taken care of, will progress to cardiovascular collapse. Gastrointestinal symptoms beside nausea and vomiting, you will see abdominal pains and diarrhea in vagal shock. So in the management part of the anaphylactic shock, you will be first doing ABC triage, where airways maintenance by giving intubation, performing tracheostomy is preferred. Oxygen is given in high concentration. Tracheostomy or intubation with tracheostomy will be performed only in the cases where intubation is not possible. Then we will administer the adrenaline injection about 0.5 to 1 ml of 1:1000 solution intramuscularly. We will maintain the fluid restorage with the about 0.5 to 1 liter fluid will be restored to about every blood pressure. But talking about fluid restoring, then 6 to 9 liters is required for adequate restoration of the blood volume. Beside this, intravenously 300 mg of hydrocortisone will be administered in anaphylactic shock. Along with this, 250 aminophylline 250 mg aminophylline intravenously in 20 ml of dextrose to reveal bronchospasm is given. And slowly we will be giving diphenylhydramine 50 mg intravenously. If hypotension still persists, then dopamine is administered. Ventilatory support is necessary in the critical patient. IV, if required, atropine and glucagon will be given to the patient. In vagal shock management, you will place the patient in the recumbent position. That is, legs will be elevated above the head. Ventilate the room, place the cold damp cloth on the face, give the reassurance. Okay. So this was the difference between anaphylactic shock and the vagal shock. We will talk about certain medical emergencies in the dental practice now. Second topic. In medical emergencies, first we will talk about syncope. In syncope, patient will feel giddy, weakness will be there, patient will be pale and sweating will be there. How will you manage it? You will discontinue the procedure in the dental practice and lower the chair back while patient's legs are slightly elevated in the recumbent position. This position is aiding the venous flow return to the lower portions of the body, while preventing venous return from the lower position of the body, while preventing the venous congestions in the upper body. But in the cases where the patient is conscious, then he should be instructed to take deep breaths. If any time patient loses consciousness unexpectedly, then respiratory pathway patency should be maintained. If there is any significant change in the respiratory pattern, pallor, patient is becoming, or there is tachycardia or bradycardia, then artificial ventilation is required. Give the supplemental oxygen. But in the cases where the breathing is present, you will take ammonia salt solution in the cotton or a spirit swab, hold it under patient's nose to retrieve the consciousness. Escort the patient to his home. Second medical emergency that you will be taking care of is hyperventilation. In hyperventilation, you will see along with the presence of the giddiness, there is also the rapid respiratory rate, rapid breathing with numbness of the fingers and the toes. Palpitations are present, and we will be telling that patient slowly rebreathe the exhaled air, keeping a paper bag in front of him or her. And in the diabetic patient, though, this is not the procedure that need to be followed. In asthmatic case, wheezing will be audible. Extremities will turn blue in the asthmatic episodes because of presence of breathlessness. So if it's an acute respiratory exacerbation, pulse rate is more than 110 per minute, respiratory rate more than 45 per minute. In such cases, 4-meter dosage of bronchodilator is indicated. But in the life-threatening conditions, high flow oxygen, salbutamol, prednisolone, and salbutamol puff repetition every 15 minutes is advised. Now in fourth, medical emergency, angina pectoris. Patient will complain of difficulty in swallowing, pulse is bounding, presence of chest pain, that is crushing radiating towards the arm, left arm. Stop the dental treatment, give the glycerin sublingual tablet about 0.6 mg. Repeat same dosage about 5 minutes. After 5 minutes, again repeat it if pain continues. If improvement is not there within 10 minutes, transfer the patient to the hospital, considering it as progression to MI. In acute myocardial infarction, moderate to severe crushing chest pain is there, where this pain is not relieved by the glycerinitrate sublingual tablets. Ambulance is called, 100% oxygen is given. Patient is administered with 300 milligram tablet of aspirin if it's conscious. And opioids are given for controlling the pain on the way to the hospital. In the condition of cardiac arrest, where patient is unconscious, breathing is not present, no palpable or even irregular pulse is there, then cardiopulmonary resuscitation is initiated. Early defibrillation is done. Medical management is started with appropriate drug on the arrival of the ambulance. Epilepsy, presence of sudden unconsciousness, apnea, cyanosis, and involuntary movement of the body. Is treated by removing immediately all the dental equipments from the mouth of the patient, tight clothing between the jaw. Tight clothing should be loosened, and between the jaw there should be a separator so that patient doesn't bite the tongue. Restraining of the patient should be avoided. Clear the airway patterns, and aspiration needs to be avoided in such cases. So we'll put the patient in the lateral position till the attack is stopped. Now comes hypoglycemia. Patient will be confused in hypoglycemia. Behavior is altered. Speech is slurred. Loss of consciousness. Rapid fall in blood pressure. Patient is shivering. Drowsiness, sweating, hunger, tremors are there. We will administer the glucose. In such cases, glucagon is given parenterally where loss of consciousness is observed. In hyperglycemia patients, polydyspesia, polyuria is there. Patient is dehydrated. Ambulance is called immediately. In the patient of adrenal crisis, where loss of consciousness is accompanied with impalpable pulse, there is rapid fall in the blood pressure. Patient is kept in the supine position with raised legs. Airways should be cleared and oxygen is given. Hydrocortisone intravenously administered, and by this time patient needs to be transferred to the hospital. Now, anaphylaxis, patient with sneezing, circulatory collapse is there. Then we are practicing adrenaline hydrochloride injection subcutaneously, 0.3 mg to 0.5 mg. Intravenous fluids to correct the hypertension. Glucocorticoids are administered and bronchodilators are administered along with antihistaminic drugs. Any questions still here? So now I'll be discussing about the drug reactions. This can come as an important short note. Whenever we are giving a therapeutic level of drug where unwanted side effects or toxicities come, these unwanted side effects, exaggerated toxicity is referred as adverse drug reactions. These are divided into two parts. Number one, predictable reactions from the side effects, overdosage or toxicity, or predictable reactions in form of idiosyncracy or hypersensitive reactions. Now, the drug reactions that you need to understand are side effects, toxic effects, poisoning, drug intolerance, and idiosyncrasy. In side effect, beside this, there are drug allergy, photosensitivity, and teratogenicity. In side effects, the therapeutic effects will be accompanied with undesirable effects, like anticholinergics in treatment of peptic ulcers will cause xerostomia. So we immediately need to stop the drug, need to find out the substitute. In the cases of the toxic effect, the toxicity will be developed whenever the drug is used for the longer period of time in the therapeutic dose form. For example, isoniazid for tuberculosis is given, and for a long period of time, it will result in development of the peripheral neuropathy. Drug-induced peripheral neuropathy will be a toxic side effect in this case. Follow to this, if in large doses drug is consumed for a prolonged period of time, it will cause the poisoning. Fourth is drug intolerance, when patients are intolerant to the drug in small therapeutic doses even. For example, chloroquine in usual dose cause nausea and vomiting, and that intolerant person will be even becoming severe emetic in cases where single tablet is administered. Now comes idiosyncratic drug reaction. In idiosyncrasy, abnormal reactions to any drug which occur in individuals who are genetically predisposed to it will be observed. Allergy to any drug independent of its dose in a particular individual's body system is generally related to the humoral factor or cell-mediated immunity. Photosensitivity drug reactions are exposure of skin to ultraviolet rays or suns, leading to the cutaneous reactions. Similar form is seen in drug-induced sensitization. Drug-induced sensitization of the epidermal layer, where these cutaneous reactions will be produced. So drug is teratogenic when it harms the fetus. In teratogenicity, such types of drugs should not be given to the pregnant ladies. Now we will be talking about other topic. This is about the diagnosis of malignant melanoma. In this, ABCD rule is followed. This can come as an important short note answer, where we will be talking about the mole or black color dot or any lesion that might be transferring into a malignancy. Okay, so if it is becoming a asymmetrical, A for asymmetrical, half of a mole or a birthmark that does not match the other, or it's changing in a due period of time, needs an immediate attention. Follow to this, borders of this mole or a birthmark are irregular, ragged, notched, or blurred. It's on the high risk platform. Color is changing, not same all over the shades of that mole. Brown or black in some area, reddish and white in other, and these colors is vibrating. Now diameter is larger than 6 millimeters, about half an inch. So or area is growing. Then this all parameters will pose that mark, brownish grayish tinge on the skin, into the category of the skin cancers or malignant melanoma. We need the biopsy and further investigations to be done. Okay, shall we proceed further? So now I'm talking about the sepsis syndrome. In sepsis syndrome, actually what is happening, there is an inflammatory response to an infection in which you will see the clinical features like tachycardia, fever, tachypnea, inadequate blood flow in the internal organs to the body. This syndrome is the common cause of the life-threatening situations, even to death in severely ill patients, critical patients. Sepsis syndrome is generally seen as a combined effect of a violent infection where host response to the infection has failed. Infection of the lungs, abdomen, or urinary tract, infections in other body sites are also major causes, which can also be accompanied with certain exacerbated response or complications like shock, organ failure, disseminated intravascular coagulations, jaundice, altered mental status, metastatic abscess formation. How will you manage this case? You will eradicate the first underlying cause of the infection and support the following organ system, giving the palliative treatment. Maintain an open airway, maintaining the fluid and electrolytes. Adrenaline should be given to the patient. Draining and debridement of the abscess. In case present, heparin is given to lessen the risk of the venous thrombosis. Antibiotics such as cephalosporins or penicillins are given. Easy? Good. So these were 5 topics of today's class. Any other queries that you want to talk about, please tell us.